So Mario, welcome and thanks for joining us. Do you want to introduce yourself?
Sure. My name is Mario Macis. I'm an economist. I'm a professor in the Johns Hopkins Carey Business School. I'm also a core faculty member in the Hopkins Business of Health Initiative. I'm an applied economist, and much of my work focuses on how economic incentives interact with psychological factors and social norms. My research falls into three main areas: the role of incentives in shaping pro-social behavior with a special focus on blood donation. I'm also interested in understanding people's preferences for policy options to regulate morally controversial exchanges, particularly compensation to organ donors. And I also more broadly use interventions to and incentives to induce behavioral change in health-related contexts.
Fantastic. So tell us the subject of your brief, the area where you're focused.
Yeah, so there is a severe organ shortage in the United States, in particular of kidneys for transplantation. Every year, about 6,000 people either die or drop out of the waiting list because they became too sick to receive a transplant. Now, the alternative to a transplant is dialysis, and that is expensive. And because end-stage renal disease qualifies patients for Medicare regardless of age, much of the related expenditures are funded with taxpayer money. Total Medicare expenditures for chronic kidney disease and end-stage renal disease are about $114 billion, or about 20% of Medicare's annual budget. So reducing the kidney shortage by increasing the number of living kidney donations would have large benefits for society and also for taxpayers. But there are currently several financial burdens for donors that limit living kidney donation. Existing estimates indicate that a living kidney donor faces up to $38,000 in direct and indirect costs from the donation, and currently only a fraction of those costs are reimbursed.
So what you're focused on is, in a sense, covering those costs. Is that the policy intervention you'd like to see?
Yes, my brief, building on the work of others, my brief proposes a comprehensive set of measures that would remove all financial disincentives to living kidney donation. These measures would include three main components. First, a system of reimbursement of all direct costs, including things like travel and subsistence, lost earnings, and the cost of dependent care. This objective could be potentially achieved with a robust expansion of the National Living Donor Assistance Center program that currently exists, that covers a subset of costs for a subset of donors. A second component would consist of a sort of comprehensive insurance packet that would provide donors with short-term life insurance, disability insurance, and also health insurance for long-term medical care. This is to protect them from, again, short-term post-surgical complications, and also from long-term health issues that may be caused by the donation. And the third component would consist of a refundable tax credit to offset the inconvenience, pain, anxiety associated with the surgical procedures. Some have suggested a $5,000 tax deduction or tax credit. Now, this proposed measure would probably require a congressional amendment to the federal law that regulates organ donor compensation. But this is the idea: a comprehensive packet of measures that would offset any direct and indirect financial costs that currently limit living kidney donation.
And so if we put that comprehensive package in place, what are the savings that we can we can achieve?
Yeah, so kidney transplantation, we know that provides better outcomes for patients compared to the alternative, dialysis, and is also less expensive. Existing estimates indicate that the present discounted value of taxpayer savings from each additional kidney transplant is about $150,000. So a comprehensive program that would eliminate all financial disincentives to living donation of kidneys could save taxpayers between $1 billion and $3 billion per year, approximately half a percent of Medicare spending. Now, total societal gains could exceed $7 billion a year, according again to existing estimates. So compensating donors instead for only a subset, only part of these costs would have a more limited impact on supply. It's also difficult to sort of gauge the precise effects of all possible, policies. I think that it would be important to conduct pilot randomized trials to estimate the effects of various possible forms or combinations of different forms of reimbursement and compensation to living kidney donors.
Fantastic. Well, thanks for all of your work, and thanks for sharing it today.
This is great. Thank you.